So, good afternoon, everyone. Thank you for attending Fundamentals of Workplace Psychological Health and Safety webinar. Today's session is proudly delivered by AP Psychology and Consulting Services, a leading workplace psychological health and safety specialist. AP Psychology partners with Australia's top organisations to deliver award-winning evidence-based solutions that help workplaces manage psychosocial risks and support employee wellbeing. We're joined by Krisha Hunt, Principal Consultant and Registered Psychologist with over 20 years of experience across Australia and internationally. Krisha is known for her deep expertise and practical approach to helping organisations create mentally healthy, high-performing workplaces. Supporting the polls and Q&A is Josh Marsden, Digital Solutions Manager at AP Psychology. For those who don't know me, I'm Lara Smith. I'm the Injury Partnership Manager at DXC, and I'll now hand over to Krisha.
Awesome. Thank you so much, Lara, and welcome everybody again. Welcome to this afternoon's webinar, and thank you for joining us this afternoon. I'm very pleased to have been invited to talk about workplace psychological health and safety, something that I personally am very passionate about, but also obviously here at AP Psychology and Consulting Services, we're incredibly passionate about as well. And we work with a whole range of different clients across different sectors, different industries, different sizes, different locations. But what our experience tells us is that organizations are still navigating this space in terms of psychological health and safety and what it means. And also what they're really looking for, and what some of you today will be looking for, is how do we understand this a little bit more deeply? How do we understand what the hazards are? How do we know how to control them? And how do we gain that confidence that we're set up for success in relation to existing and upcoming, in Victoria, legislative changes? So with that in mind, what we're going to cover today is exactly that. What is psychological health and safety, and why does it matter? What are the legal and ethical responsibilities for leaders and employers as well? And also then look a bit more in depth at what are the tools that are in existence that you can use to identify and assess and then manage those psychosocial risks. And you'll see that Josh has just popped a poll up there as well. So if you would like to have a quick read of the poll in terms of what challenges you face for creating a psychologically healthy and safe workplace, and we will hopefully be able to address some of those throughout today's session. In the session as well, at the back end of the session, we're going to look at a real world case study as well. And hopefully what that case study will do will provide you some insights into those real world actions that assisted a particular client of ours that we work with to support improving the psychological health and safety of their workplace. And with a bit of luck, we'll have some time for Q&A as well. And then I will be handing back at the end to Lara also. So that's what we're going to cover in the next hour. Can see the results of that poll coming through now. So at the moment, what's leading in terms of the challenges that you guys are facing is the lack of understanding, so that knowledge piece. So hopefully that will be clearer by the end of this afternoon's session. But also things in there as well, like the lack of internal capability and the lack of time as well. So this being seen as something that is an additional requirement to what everything that everybody has got on their plates already. So let's have a look then at what we mean when we talk about a psychologically healthy and safe workplace. So there's a definition up there, and like most formal definitions, a little bit wordy, but psychologically healthy and safe workplace is one where risks are acknowledged, appropriate action is taken to minimize or potential negative impact on an individual's mental health. Sorry, apologies for the going back. So when we strip that down, fundamentally, it's about looking after our people and looking after our workforce. And that's very similar in terms of what we already do in terms of physical health and safety. And in fact, there's a lot of principles from physical health and safety that we can apply to psychological health and safety. Right there in that definition is pretty much the exact same definition that we would use for physical health and safety. So we acknowledge in any environment, any work environment, there are some safety risks. And what we need to do as an organization, as the people within the organization, is acknowledge what those risks are and take the appropriate action to minimize the impact of that. At the moment, we talk about physical health and psychological health and safety separately. My particular opinion is that in future years to come, we'll actually just talk about health and safety, and that will absolutely mean both physical health and safety and psychological health and safety, because the principles are so similar. What we want to do is make sure that we are looking after our people, and we've got a responsibility to make sure that we're positively contributing to their well-being, and essentially that we're doing no harm. So we want people to walk away from the end of their day, the end of their shift, in as good as or possibly better condition than they arrived, and that is both physically and mentally as well. So, but as I say, stripping it right down, it's about looking after our people. And why it's important, there's lots of reasons why we want to pay attention to this and why it's really important, and it is on a lot of organizations' agendas as well. So, in terms of the prevalence of mental health in society more broadly, we know that about 1 in 5 Australians will experience a mental health condition during the year. So that's about 20% of people. So that's 20% of us here on this webinar today. It's 20% of our friends and family. It's 20% of the people that we work with as well. So we know absolutely that it's highly likely that we're going to be in contact with, at some point, somebody who has a mental health condition or who is struggling. And some of us on this webinar today will have first-hand experience of that. That will be something that's very close to us, or at least near-hand experience. So again, our friends, our family members might be experiencing mental health challenges. So it's really important that we know, as workplaces and people within workplaces, and particularly leaders within workplaces, we know how to navigate that. We know how to support people, and we know what to do if people are struggling, and that we know what to do to minimize the likelihood of the workplace adding more negative impact to that particular situation. So there's a real kind of prevalence there, and a real need for us to understand what mental health in the workplace look like, and again, how we can actually contribute to positive mental health and well-being as well. So that's, I guess, the sort of individual almost drivers around that. We know that we can make such an impact on individuals' lives and the experience in their lives, but there's also economic and legislative drivers as well. So we know that it's about $39 billion a year lost from the Australian economy, which is related to mental health and mental ill health. So about 14 billion of that is related to presenteeism, so where people are physically at work, but not really necessarily as engaged as they could be, or not as productive as they could be because they are struggling and because they've got those mental health concerns. About 8 billion is related to absenteeism, so people taking time off, of course, away from work if they're not well. But 1.2 billion related to claims as well, so psychological injury and illness claims. And we know that psychological claims are 4 times, on average, 4 times as expensive as physical health claims, and last about 4 times as long as well. So people's time away from the workplace and that lost time injury is much more impactful from psychological injuries than it is for physical injuries. So a lot of economic drivers there for organizations to reduce the claims and reduce the impact of that on their productivity and on their bottom line as well. And there's also reasons why we want to invest in mental health and well-being strategies and controls to manage psychosocial hazards. We know there's so many benefits to it as well. So we don't necessarily just want to take that stick approach of, well, the legislation tells us to do so, and we've got to get our claims costs down. We know that there's so many more benefits to having a psychologically healthy and safe workplace as well. We know that people feel more engaged, more cared for, more valued, and where you have got people who are more engaged, cared for, and valued, they tend to be more productive. You tend to find more creativity and innovation. People feel safer to be able to come up with new ideas and try new things without necessarily fearing any negative consequences of that as well. So you get then these sort of flow-on effects if you get improved retention and reduced turnover, etc. So there's lots and lots of reasons why anybody would want to invest in having a psychologically healthy and safe workplace. And back to the economic drivers as well, PwC studies showed that there was about an ROI of about $2.30 for every dollar spent on mental health and wellbeing initiatives in workplaces, that those workplaces would recoup $2.30. So 2.3 times ROI on mental health and wellbeing initiatives, which is fantastic. So we want to make sure that we can support people to create those psychologically healthy and safe workplaces and have people thrive and be the best versions of themselves, and also for organizations to thrive alongside that as well. we as leaders and people within organizations actually have not just a role and responsibility to do something about this, but also what that comes with is a chance to influence those stats that I was just talking about. There's a chance to influence how people are experiencing life, how they're engaging in work. There's a chance to influence those claim stats. There's a chance to influence that amount of money that we're losing to the economy. So we actually have a real opportunity for change and positive change here, which is a really, that's a real opportunity for us to actually do good and again help people thrive and help workplaces thrive as well. So that's the sort of why we're interested in doing this, because of all of those drivers. But how do we actually do that? And what I'm going to go through next is a bit of an overview and an intro into best practice psychosocial hazard management. Now, many of you on the webinar here today might be familiar with some of this, or perhaps all of it. So hopefully some of it will be a bit of a refresher. As I said, what we're going to do is then bring it to life in the case study that we'll get to a little bit later on as well. So I'm going to be referring to Safe Work Australia's Code of Practice, which is one of the codes of practice that is available to us here in Australia. Most of the codes of practice, whether they're state-based or federally based, are very similar in terms of the principles in there, the hazards that they identify, and the mechanisms for controlling those hazards. So I'm using the Safe Work Australia one just for to make that simple because it goes across the whole of Australia. So what we can see here is the 4 steps of psychosocial hazard management as outlined in that code of practice. So you can see quite clearly the 4 steps there: identify hazards, assess risks, control the risks, and then review the controls. So we will look at each of those in a moment. But what you can also see in that model, and the 2 things that are really, really critical and crucial to effective psychological health and safety management, is the inner circle, leadership commitment, and also the outer circle, consultation as well. So having senior leadership on board is so important to be able to have effective change, essentially, which is what you might be tasked with doing when you're undertaking psychological health and safety initiatives. And in my experience, certainly in working with all of our clients, the clients that tend to fare best and are most successful are the ones that have got senior leadership commitment, senior leadership buy-in right from the get-go. And sometimes we support to help get that, but also where there's a really integrated approach to the initiatives as well. So where both P&C or HR on the one hand are working alongside OHS, health and safety, and both of those groups and both of those divisions are working together to achieve psychological health and safety, because there's so much overlay. And again, that goes back up then to your leadership commitment of having that buy-in at those heads of level and exec director level. So to be effective, ideally you want that kind of senior leadership buy-in, so that it's an agenda item, that it's on the leader's agenda, that it gets revisited, and that it is seen as priority, and therefore the appropriate resources are targeted towards that as well. So can't emphasize strongly enough how that leadership commitment is so important in being the difference between battling uphill a little bit and then be able to get some really effective initiatives in place. Moving to the outside of the circle, the consultation, you can see that it wraps around every single step as well. And that's because the code of practice is absolutely suggesting, quite rightly, that we consult essentially with our workforce. So at every single step and at every single stage, we should be asking our workforces what's important to them, what's impacting them, are the things that we're thinking of doing going to be helpful, not going to be helpful. We absolutely need to consult, and we'll look at how we can do that. And again, many of you will already be doing some of these things. But those 4 steps, centered by leadership commitment and surrounded by consultation, are the keys essentially for managing psychosocial hazards. And following the steps, simple. That's all you do to make sure that your organization can be psychologically healthy and safe. So we're going to unpack that a little bit, because obviously there is a little bit more to it. So looking at roles and responsibilities before we go too much further as well, though, again, the codes of practice outline what the responsibilities are across organisations. And again, this is taken from Safe Work Australia, the code of practice from 2022. And without reading every word on the slide there, essentially what this is saying is that this is a shared responsibility. So it is not just on the organisation and the leaders of the organisation. It's not just on the people leaders and the frontline leaders within the organisation. It's not just on health and safety. It's not just on P&C or HR. It's actually across everybody, including the workforce as well. So at an organisational level, what's required of us is to make sure that we've got the systemic processes, policies, procedures, etc. in place that support psychological health and safety. So things like your bullying and harassment policies, things like your fatigue management policies, all of those systemic kind of level controls need to be there so that then the people within the organisation can work within those policies and procedures. At the people leader level, and I'm talking every people leader level from exec directors through to frontline shift supervisors, have a responsibility as well to then enact and execute on those policies and procedures. So to be aware of what does good look like, to be aware of what the bullying and harassment policy and procedure says, knowing when to intervene, for example. So as a leader, we have a responsibility to make sure that we are proactively and encouraging people to engage in psychologically healthy and safe practices. And similar at the staff level, so the whole of workforce level, there's a requirement for people to know what psychological health and safety looks like. And again, for people to comply with rules, regulations, policies, systems, etc., that support psychological health and safety. So, for example, making sure that we do treat each other with respect and that we're not engaging in bullying and harassment, for example. But the key is that it's not just all on one set of people or a couple of people within an organization to do this. This has to be an absolute ecosystem, and I'll probably use that word a lot in today's session, but it needs to be an ecosystem of everybody working towards that same goal. So the systems and processes set by the organization, and then people actually being able to execute on those as well is really important. So that's a little bit about the roles and responsibilities. In terms of what the actual hazards are, so we talk about, step one, identifying hazards. We've got a bit of a head start in terms of identifying hazards because of the work that people like Safe Work Australia and the other regulators have done. What the research has shown is that there tends to be common psychosocial hazards, and you can see those listed up there again from Safe Work Australia's Code of Practice. So you can see that they identify 14 what they would call common psychosocial hazards. Excuse me. And the reason that they're called common is because the research has suggested that pretty much everybody, no matter what role you're in, no matter what organisation you're in, no matter what level of role you're in, at some point there is a likelihood that you'll be exposed to one or probably more than one of these hazards. Every single organisation's profile is going to look a little bit different. So, for example, emergency services are going to get a lot more exposure to traumatic events and materials potentially than, say, an accountancy firm. However, we know that in general, these are the common hazards that people are likely to face in our workforces. So what it's about knowing is what is our organisational profile? What are the key hazards that we, your organisations, are likely to be battling with and are likely to be needing to look at how we control and how we reduce the impact of those. And certainly, as I'm sure, as you're looking on the screen there and reading some of those, that some of you will be sitting there going, yep, we've got that. Yep, we've got that. Yep, we've got high job demands. No, we've got issues with low job control. So these are very, very common, and every organisation will have a profile. And I've not worked with a single organisation that doesn't have any of these because that's unrealistic. So there will be hazards. It's about identifying which are the most impactful for you, and then also the ones that you can have the most control over and the most influence over so that you reduce their impact as well. One final thing to say about the hazards as well, though, is that the codes of practice, as I say, identify these common hazards, but the codes of practice also suggest that organisations should look to see if there are any unique hazards that exist in their particular workforces that might not exist in any other workforce because of the type of work that you do or the industry that you're working in. So these are the common ones, but there's also work to do in terms of finding is there anything else that might be impacting our workforce that we need to pay a little bit of attention to. So we have a bit of a head start with IDing what the hazards are. So that is step one, essentially, in terms of the 4-step process. But there's other things that we can do as well, other than looking at the legislation, the codes of practice, to find out what our particular risk profile might look like, what our organisation's hazards might be like. So using the existing data, so all organizations to a greater or lesser extent will have data existing that points to some of the psychological health and safety concerns that might be present. So it's things like looking at your claims data. So are you seeing an increase in psychological claims? What is the reason for those psychological claims? Have you got increases in your grievance data? What is that all about? Looking at complaints, etc. So what is the data that you've got already in your organization that can help you to start to identify what some of those hazards might be? Even things like leave records. So it's things like your unplanned leave going up. And that seems to be unaccounted for. Are there things like your EAP usage that seems to be going up? So looking at all of those different sources of data that you can reference, that starts to give you a little bit of a sense of what the themes might be in terms of the psychosocial hazards that your workforce might be facing into. But of course, going back to the consult, asking your workforce is the absolute key in finding out. So that can be through surveys, that can be through focus groups, that can be through business as usual one-on-one team meetings, it can be through town halls. Doesn't really matter how the consultation happens. It's the fact that we are having that consultation and finding out, you tell us, workforce, what's impacting on you and tell us a little bit more about that. So what we can do through that as well is find out if there's any specific teams or hotspots that might be experiencing a slightly different set of hazards compared to others, or the impact of those hazards is more extreme compared to others. So consulting with your workforce, consulting with different parts of your workforce to understand what those profiles might look like is super important in terms of identifying those hazards. And thirdly, you can, of course, always observe the work that your people are doing. So again, whether that's as BAU, as a people leader, just looking around and seeing, are people struggling to get everything done in time? Are people struggling with their priorities? Do people feel like they're exhausted from another round of change? What's actually going on around you? What can you pick up from just observing what's happening in your team and in your workplace that, again, might give you some insights into what the specific hazards are that you're facing into? So that's step one. We've identified them. That's great. What we want to be able to do, though, as well, is assess the impact of those as well. So looking at essentially the frequency, duration of exposure to those different hazards, and then what the actual impact might be. So whether that's something that would require time off work, something that would require some support, some counselling, whatever that might be. So looking at what the actual impact of those different hazards are, again, that's going to look different for different teams in your organisation potentially. So if you've got a team that is absolutely dedicated to dealing with customer complaints, then they might be more likely to be experiencing the impact of people that are aggressive, rude, etc., because they're dealing with complaints 8 hours a day, 5 days a week, compared to other teams or other parts of your organization where they don't have to deal with distressed people or angry or difficult customers because that's not part of their role description. So understanding what the impact of those hazards is a really important part of understanding the whole picture before we can start to look at, well, what controls then do we want to put in place? And we've popped up another poll there as well. So asking you how confident you are in identifying and assessing psychosocial hazards and risks, because actually these steps 1 and 2 tend to kind of go hand in hand. So we've got on a rating scale of 0, we're not feeling confident, up to 5. People are sitting in that kind of middle range. So 46, 47% sitting at around about 3 and upwards, and a bit of a spread as we would see. So as we would expect to see as well. But again, hopefully this is starting to give you some insights in how you can start to identify and assess some of those hazards. And again, this isn't something this is often something that might land on your desk as a P&C person or as an HSR or as a OHS person, but actually it's going to take more than one person likely to actually be able to solve this and to be able to actually come up with a decent, again, ecosystem of supports and controls. So working with your team members, working with other subject matter experts in your organization is going to be really critical. So if you're sat there at the moment going, I'm only one person, I don't know how to do this, thinking straight away, okay, who else in my organization do I need to reach out to get support and get help with this? Particularly if you're in a very large organization with lots of different divisions in it. So it's not all just on one person. It definitely is a group effort to get psychological health and safety controls in place. And that's what we're going to look at next. So step 3 here, the control the risks or control the hazards. So if we've identified them and we've assessed them, we've decided that, we've got some issues with job demands. We know that people are feeling overstretched and overworked. We've got some problems with job control, people feeling like they don't have a lot of autonomy, for example. And we've got some issues with change management, for example. What we then want to do is kind of say, right, what do we want to do about those things? And the reality is, when you've done a risk assessment and you've looked at those hazards and looked at the impact of those hazards, there'll be some level of rating for most of them. So where this control risks, where you need to start to think more practically is looking at, well, what are the key ones that are impacting our workforce at the moment? Because it can be really overwhelming to think, right, I've got to sort out every single hazard, every single risk, and I've got to get controls in place. So having a staggered approach, and this potentially could be linked to a wider health and safety strategy, but looking at what your priorities are and picking your priorities is absolutely crucial to be able to do this on a practical basis. And that's what we work with our clients to do as well, to help to prioritize that and kind of look at, well, where are you going to get most impact? And what kinds of hazards are going to be affected? What kinds of hazards are going to be controlled if you were to put in X, Y, Z to see what the flow on effect of that might be? So really prioritizing and understanding which ones you kind of want to target first and which ones are going to have the most impact. Again, because hazards, like everything else, are an ecosystem. So if you've got a lot of change happening, and you've got high job demands, and you've also got poor support, for example, that's a potentially worse picture than having really great support and a lot of change going on and job demands impacting as well. Because if I feel like I'm really stretched at work, there's a lot of change happening and I'm not quite sure, what's going to be happening with my role, but I know that my leader is super supportive. They're telling me everything they possibly can when they can. I know that I can go to them and kind of have a bit of a vent, but also get some ideas on, how I should be approaching my work now that I'm in this sort of period of ambiguity. If you've got that, that's a better picture than, I don't know what's going on. I don't know what's going to happen to my role. I'm absolutely overworked and my manager doesn't even have time to listen to me or to give me any direction or any prioritization on what I should be doing. So it's looking at all of the hazards and looking at which ones are interacting with one another, and then therefore which controls you might want to put into place that are going to have a bigger ripple effect. So in that case, actually increasing your leadership support might then have a positive impact on change management and job demands as well. So it's definitely around that prioritization. So we're going to spend a bit of time just digging into that a little bit more. So looking at how we actually approach controls and what we need to think about when we approach controls. We take an integrated approach, the prevent, protect, support approach, which is very widely known, very common. And obviously it's talking about primary interventions designed to stop harm before it happens, secondary interventions, which are designed to help support people when they're facing into some of those hazards, and support, which is obviously more of a tertiary intervention if somebody has been impacted by the hazards and has an illness or an injury. So we go with that prevent, protect, support approach. And again, having that overlap, having lots of different controls that sit across all of those different domains is important, because if you put all your eggs in one basket, you're not going to be able to have the right kinds of supports when with different hazards and the impacts that those hazards have. So prevention, protection, support is a really solid framework to begin with, to think about, right, what controls have we got in place that are primary in nature? What controls have we got that are secondary in nature? And what controls have we got that are more tertiary? And sometimes what can happen is that organizations can be really good at one of these, but not necessarily the other two. So organizations potentially have a lot in the support category, but not a lot in the prevention or protection. So what we want to be able to do is support people and the organizations to understand where their controls sit in that framework as well. And this is the 7 workplace strategy framework, which AP Psychology and Consulting Services developed, and it's based on work done originally by University of New South Wales and the National Mental Health Commission, and also Black Dog back in 2014. So it takes into account those different kind of levels of interventions, the primary, secondary, and tertiary. And what you can see there is there's 7 different categories, for want of a better word, of types of interventions that any organisation can put in place that span across prevention, protection, and support. And just to give a little bit more detail on those, as you can see, they're color-coded. The green ones are those primary prevention mechanisms or controls. The orange-colored ones are the more secondary or protective level controls. The red is support recovery tertiary level controls. but there's two there you can see in blue as well: build leadership and increase awareness. Those actually span across all prevent, protect, and support. So there's elements of build leadership and increase awareness that sit in all of those categories. And those two can actually be some of the most powerful interventions that you can put in place, some of the most powerful controls that you can put in place that have that ripple effect across a lot of other hazards. So for example, as I was just saying with the build leadership, if you've got leaders who are really comfortable, confident, skilled in being able to navigate psychological health and safety, navigate mental health at work, know how to spot signs of distress, know how to intervene early, know what kind of support mechanisms are in place, that's hitting on a lot of other areas, essentially, just by looking at your leadership capability. Similarly, increasing awareness across the workforce in terms of what is psychological health and safety, what's my role, what's my responsibility, will then also have a ripple effect across all of those other categories. And that includes things like being able to make decisions about work design, so how we actually structure the work that we do to minimize the negative impact of hazards. How we make sure that we're building really strong, positive workplace cultures, which we know is really foundational, really important in terms of having a workplace where there is civility, respect, where people trust one another, and where that sort of more individual psychological safety piece comes into play, where people feel there's a level of trust there and people can raise concerns. Where we're talking about building resilience and coping skills and early intervention, this is more around leaders and individuals knowing what the strategies are already that help keep themselves well, knowing the signs of when they're not coping so well, and helping people or directing people to get that early support as well. And that might be things like your EAP program. It might be things like resources that you have on your intranets around mental health and well-being in the workplace. The support recovery, as I said, is more those strategies that are around helping someone return to work. So if they've been off with an illness or an injury, how do we make sure that we can bring someone back into work without re-injuring them, essentially? So if we've not changed anything in the workplace and someone's coming back into the same circumstances, the likelihood is we're going to get the same result, we're going to get the same outcome. So we want to make sure that we have looked again then at what's the work design, how are we helping people to come back into work in a sustainable way? Have we made any changes to the way the job is done, where it's done, how it's done? All of those things will make an impact on how sustainable a return to work might be. So the idea behind the 7 workplace strategies then is really around having, again, this ecosystem of controls that all of these map onto one or more of the hazards that we were talking about, that I was outlining before. So all of these are designed to have a positive impact in terms of controlling the negative consequences of some of those hazards. And it's a nice framework to be able to hang your initiatives off. So being able to take a step back and a more strategic look at what you're doing from an organizational perspective, rather than just looking at just the hazards and the individual controls against the hazards, looking at this from a 7 workplace strategy perspective, saying how good are we at smart work design? How much attention do we pay to that? And that's a primary intervention. How good are we in terms of our leadership capability around this space? Again, that's going to impact everything. How good are we with our support recovery? Are we finding that we tend to put a lot of emphasis, for example, on our work culture and kind of hope that that's going to be the thing that helps to protect everybody, when actually we need to make sure that we've got a range of different interventions across those different strategy areas. So I know that's a lot of information already in terms of thinking about how you actually start to build essentially a toolkit, a strategy around psychological health and safety, and knowing what controls and what processes you've got in place. Taking it from a framework-based perspective can be really helpful in giving that kind of more holistic overview rather than just looking at individual controls and individual hazards. And that becomes important again when you get to step 4, which is closing the cycle, essentially. So this is all about how do we review how effective our controls are. So again, we do this through a number of different methodologies, including consult with your workforce again. So we need to find out from frontline people. We've got a bullying and harassment policy in place, for example. Is it working? Do people follow it? Do leaders know how to intervene early if they're seeing inappropriate workplace behavior, for example? We need to consult with the workforce to understand the effectiveness. You can think of the policies processes, systems, etc., as almost like the intent of the organization in terms of psychological health and safety. So we've got great suite of policies, preventions, controls, etc. That's our intention as an organization, to help psychological health and safety. Where you get the workforce consultation, that gives you a degree of information around how effective those policies and procedures are being. So is that intent actually being transferred and translated into execution in an effective way? So it's really important that we look at the whole picture, not just the intent, not just the systems that we've developed, but are those systems working? Does it turn out in practice the way that we designed it in the first place? And consultation is critical to that. And again, you'll see a poll popped up there. How confident are you in reviewing the effectiveness of your controls? So through things like consultation, again, it's your focus groups, it's your one-on-ones, it's your surveys, it's your employee engagement surveys. All of those things help to give you some information. People sitting around about the sort of midway part there as well, about 39% people feeling somewhat confident in terms of how to review. Certainly the review absolutely then leads back into step one again. So you're kind of looking at your control measures and kind of saying, these ones are effective, great. So we've got these hazards pretty well controlled. These controls are not working as well as we thought we did, and therefore we've identified that those hazards are actually still prevalent, and then we now need to again assess what the impact of that is and keep going around the circle. So the other point to take out about this 4 steps of psychosocial hazard management is that it's a continuous improvement process. So it's absolutely ongoing, and having a mechanism by which you can make sure that you're stepping through each of those steps on an annual basis, for example, means that you're going to be still looking at things as they evolve and as they are live in your environment, rather than doing a one and done assessment process. This is very much a continual improvement cycle. So that's a lot of information around very high level 4 steps to controlling hazards and identifying, assessing hazards and controlling hazards. What I want to do now is hand over to Josh. He's going to talk through some of the tools that are available in terms of helping organizations put that into place. And then we're going to come back and we'll talk about a case study that brings some of that to life as well. So over to you, Josh.
Thanks, Krisha. Lots of great content there around psychosocial hazard risk management. And yeah, really just wanted to talk to you about how we help our clients with their psychosocial risk management and make sure it's really easy and accessible for organizations of all sizes to do so. And for that, we've been developing over quite a number of years the TM Thrive platform and app. What is TM Thrive? It's a purpose-built platform that helps organizations manage psychosocial risks with confidence. It combines our own validated risk assessment tool, real-time reporting dashboards, as well as targeted micro-learning modules to help people upskill the capability across their risk profile as well, which ultimately helps reduce the psychosocial hazards. Through that platform, it also provides automated reporting across key controls, and it does that at multiple levels as well. So think in organization-wide, department level, unit level, as well as any sort of other demographic splits. That's the elevator pitch of what TM Thrive is. What it actually looks like in delivery is when we work with an organization, we would run our workplace psychosocial safety index. So that's our validated survey tool. We were ahead of the game when it comes to psychosocial risk management, developing this tool in 2018 and getting it independently validated by Deakin University. We've since had it validated over the last year or so, so that we are aligned to ISO and also SafeWork and state-based regulations as well. By running this survey, we're able to assess all of the core psychosocial risk factors an organization might have, as well as some that can be custom factors, say, for example, for FIFO organizations with high potential alcohol and drug use, shift work, things of that nature as well, so that we can provide recommendations that are really aligned to how they work. They get this data in a real-time dashboard, so through the TM Thrive app, and they're able to see some the controls automatically aligned to those individual risk factors as well. But we always provide that consulting support from Krisha's team also. A key part of TM Thrive also is the front end. So we actually provide learning content modules assigned to individuals, team leaders, teams, and individuals based on that specific risk profile across the risk factors there. So they're in the format of micro-learning, where it'll be a mixture of videos, quick quizzes, and then helpful resources to take action towards making change within their organisation. And we're really proud to say that 94% of leaders that have completed the TM Thrive program are confident in addressing psychosocial risk management within their teams as well. So this is how we implement this on the ground with our clients.
Thanks,
Back
Josh.
to you, Krisha.
Thank you. So yeah, bringing that together now then, just to highlight a case study where we absolutely partnered with one of our client organizations to support them in improving psychological health and safety in their workplace. We worked with a national warehousing and distribution company, and the aim's really, as I said, to improve psychological health and safety, but in an environment where they weren't really sure at that point what the hazards were, what the risks were, and exactly what they needed to do to make things better and to improve things. So we were very lucky to be able to really have a partnership arrangement with this client, where we had absolutely the leadership commitment in the center there. We did a lot of work around that as well to increase awareness of what we were aiming to do with the project and keeping people informed along the way. But what we were able to do was really create something that followed these 4 steps and help the organization ultimately to make some clear gains in their psychological health and safety. So the aim of the project, as I said, is to really help improve psych health and safety, but specifically to help the organization address what the specific hazards were that their team leaders and their team members were facing into. So team leaders were, as the name suggests, people who had people responsibilities, so who managed small teams. Because this is a national warehousing and distribution company, the environmental setting is large warehouse settings. So team leaders worked on the floor of the warehouse, but also had responsibilities in terms of people management. The team members also working on the warehouse floor, undertaking duties like picking goods off pallets on shelving and then getting that out into trucks for distribution. So working also potentially in environmental conditions that include things like cold storerooms, large warehouses, and where there was limited opportunity for a lot of team building to happen. So what we did essentially was go through the 4 steps with this client so that we could help to identify what the hazards were, assess them, look at the most relevant controls and assess those controls as well. What we actually did along the way was also to have a really strong relationship with the HRBPs in that organization, because the HRBPs also absolutely then supported the ongoing implementation of the controls that we put in place. So that was a really key factor in the success in this organization as well. But I'll step you through the process so you can see how each of those steps that I walked through earlier actually comes to life in this particular organization. So we did step 1, identify and look at the hazards that might be impacting. And what we did is look at the data that was available from the organization. So we looked at their leave, we looked at their absenteeism, we looked at their claim data, we looked at their employment engagement results, we looked at their EAP usage, but we also undertook a desktop review. So we looked at all of their policies and procedures and identified which ones were supportive of psychological health and safety, whether they fell into that preventative, protective or supportive elements of the framework, mapped those to the 7 workplace strategies as well. How much stuff do they have around leadership, for example? How much was focused on culture? All of those, just gathering a huge amount of data, and also obviously consulting with people to get the more qualitative data as well. So we ran focus groups with team leaders and also team members to hear what was impacting from them. So we can look at all the paperwork that we want, but what we want to understand is, how is this actually impacting you? How are you experiencing work? So that gave us really deep information around the biggest factors impacting on their mental health. We also did do observations at site as well. So we went out onto the warehouse floor at the sites and literally looked at what was happening, how people carried out their work, how much time they were interacting with other people, how much time they were on machinery, for example. So looking at the whole picture of how these team leaders and team members executed their work. We also did interviews with state managers and higher level executives as well, to understand what their view of things were as well, so we could get a really detailed, holistic picture. So once we'd done all that, and I've said that in 2 seconds, and that took about 6 months. We looked then at, well, what was the themes of that? What came out of that? What did we identify? So what we found from analyzing all of that data from all those data sources was that there was really poor interpersonal relationships and support. So as I said, there was a real lack of opportunity for people to connect. It was kind of, clock on for your shift, get on with your work, go home. And there was also limited leadership capability as well. What we were hearing was that team leaders felt like team members only came to them if there was a problem. And there was no kind of proactive conversations in terms of support. It was more reactionary. But that also team members felt like team leaders never spoke to them unless there was a problem as well. So I will never hear from my team leader unless I've done something wrong or unless I've made a mistake. So there was this sort of lack of, not only lack of opportunity to connect, but also the quality of those conversations was really, really quite poor as well. And that led to, understanding that there was this lack of psychological safety, individual psychological safety there. So conversations between team leaders and team members tended to be punitive and really around performance rather than more holistic about how you're going, tell me what's working for you at the moment, is there anything I can do to support you? Very much more transactional and I say, punitive in nature. I'll have a word with you if you've not done something right or you've not met a particular target, for example. And of course, the nature of the roles that those team leaders and team members were doing, they were in an environment where there was a limited opportunity to input into work-related decisions. So a lot of their work was absolutely process-orientated and absolutely kind of step-by-step, needing to go through particular processes to get through the work as well. So then we started, thinking about where can we give people an additional level of autonomy? So we noticed those sort of 3 key themes. So lack of support, lack of individual psychological safety, and low job control. And again, when we looked at all of the results, that was a huge amount of information we had. There was more than this, right? There was more than these hazards, but these were the ones that we identified and prioritized as the ones that were having the biggest effect on things like engagement, turnover, etc. And that's likely to be your reality. You will have a whole heap of hazards from those ones that we were looking at, but we need to choose the ones that you think are impacting in the greatest way and the ones where we think we have most influence as well, where we can actually have most positive impact too. So we identified the hazards and got those into themes. And then we assessed the level of risk, essentially, and we did that through our Workplace Psychosocial Safety Index, which Josh just mentioned, housed on TM Thrive. So the WIPSI is a specifically designed tool to measure psychological hazards, psychosocial hazards, developed by us in conjunction with Deakin University as well. And what it does is give you a really great current state picture of what your risk profile might look like, because we're consulting with the workforce to say, you tell us which hazards are impacting you and to what extent they're impacting on you. So we can then drill down into that. So to give you a bit of a view, a bit of a screenshot of some of the results that we had at the beginning of the project with this particular client. So we're actually lucky enough to have 2 experimental sites and 2 control sites. So the experimental sites, we were going to be able to put into place all the interventions, and at the control sites, we were going to leave them be, not do anything, and see what happened at the end of the project. So you can see there, we're just about to see on your screens, on the left-hand side of those 2 columns are some of the hazards that the WIPSI assesses. So you've got things like your psychological safety, involvement and control, learning and development, workload, sources of support, etc. And what we're asking in the questions in that WIPSI is for the workforce to tell us how much of an issue is this? Is this something that you think your organisation does well, or you think that your organisation could do better, so you don't have enough input in decisions, you don't have enough support, for example. And basically green is good and red is bad. So as you can see, the one that stands out is workload, and that's very common across all organizations, that workload is one of the things that impacts most heavily on our workforces. So only 32% of the respondents there thinking that the workload was sort of in a place where they could deal with it in a reasonable way. What you can see as well against the experimental sites and the control sites is actually pretty similar at the beginning of the project. So there are some minor differences between some of those results, but generally speaking, you can see that workload at both lots of sites was perceived negatively, that there was definitely opportunity for improvement around things like the leadership and change as well. So that's what the WIPSI allows us to do, is kind of go, great, this is your current state. This is what your workforce is telling us. And we can now use that information to further develop what the controls are going to be and understand what we need to do to shift some of those metrics. So essentially what we did then was go to step 3 and start to look at how do we actually build the controls, and do that in linked into the build leadership capability, building workplace cultures and smarter work design from the 7 workplace strategies, because that's where the particular hazard, the themes, were sitting across in terms of how we relate that from hazards to start with to the actual 7 workplace strategies. So we saw that building leadership capability was important because people were saying that they didn't have good relationships with their leaders, that there were punitive conversations, that there wasn't psychological safety. We knew that the culture wasn't positive in terms of how performance was talked about, for example, as well. And again, links back, in fact, to leadership capability as well. But smarter work design, we knew was an issue because of the lack of control and how systematized the work environment was. So we can take those hazards that we identified and map them to the 7 workplace strategy areas and go, right, these are the 3 areas that we want to focus on then. And we know that by taking a sort of slightly broader focus, there's going to be a ripple effect on many more hazards than just the ones that we are originally identifying. So we did exactly that. We looked at what we could do to build controls in building leadership, smarter work design, and better workplace cultures. So in the build leadership, we wanted to increase awareness of leaders of psych health and safety and increase their skills to have more humanistic conversations. So not just the transactional punitive conversations, but to actually be able to link in and have connected conversations with their team members. We wanted to look for opportunities under smarter work design for more interaction as well. So how is the day actually structured? Are there opportunities for staff members and their team leaders to interact more often? How can we design work differently so that can happen? And how can we design work differently so that there's more input in terms of decision making and having a little bit more control as well? We also wanted to look at how we change how when performance was addressed. So under workplace cultures, we wanted to see, again, how do we reduce the level of punitive conversations and how do we move more to a sort of coaching approach? So those were the 3 areas, the 7 workplace areas that we were focusing our controls on. So essentially, we developed a whole suite of controls. So some of that was skills-based training for leaders, where we went out and actually delivered workshops that were skills-based workshops that were, all about how to have connected conversations, how to actually have huddles in the beginning of a shift, for example, that were more inclusive and weren't just necessarily operational or transactional. Training was very focused on that education of psychological health and safety, but also that skill development as well. So practicing how to run a huddle differently, practicing how to have a one-on-one differently, practicing how to give feedback differently. So really, really giving those skills, the tangible kind of skills that leaders need to be able to practice psychological health and safety. We also looked at how those opportunities to interact and how we can change the work design. So things like what happens when people clock on and clock off. So there was found to be opportunity that there could be a team leader to be present at the shift start and at the shift end, just to say hello to people when they walk through the door. So just starting to make these small changes. So these aren't huge, massive shifts in terms of the way the organization was doing undertaking work, but these small changes all are psychological health and safety hazard controls that shift the dial. So team leaders who are there saying, welcome, Malcolm, how was your evening? We've got a big day ahead of us. Welcome back. All of those kinds of things, those really small things that all add up. So we looked at opportunities to change the way that work was done so that it could, again, impact the way that people were connecting with one another and people feeling valued, people being seen, and people feeling like they're in a psychologically healthy and safe environment. We also looked at the sort of the frequency and the way in which performance conversations were delivered. Again, moving from sort of reactionary, punitive conversations into more coaching and proactive conversations as well. And that sort of also came, some of that skills development came from the workshops that we delivered as well. So in summary, we had leaders who ultimately were trained and supported to interact with their teams differently in terms of the frequency, but also the content of what they were saying. Leaders that were trained in looking out for signs of people who were struggling as well. So if people weren't coping very well, leaders who could intervene early and kind of understand that maybe someone was having a bit of a rough time. We also said we'd work really closely with the HRBPs as well, and that was critical because what we did was develop the controls, but hand over then to the HRBPs and the sites to actually implement those controls. So we stayed in close contact with the HRBPs because they were the people who were actually then implementing and making sure that these controls were happening. So again, the idea of continuous improvement, looking at what was working and what wasn't. So what were the results? So in our experimental sites, the ones where we put all these interventions into place, we saw significantly better results across some of the data measurements that we were taking. So in terms of workplace culture, that increased by a positive regard, increased by 10%. People felt more supported by their team leaders. They felt more included. They felt better in terms of their work-life balance and felt like their psychological safety has improved as well. So they could actually raise concerns, talk to their leaders and not fear that punishment. So a 6 to 10% change, and that was in the space of around about 18 months. So we remeasured after about 18 months, which was just really great to see. And you can see again on this slide here, the difference. Actually, if I draw your attention to these columns here, you can see this is the experimental site, and pretty much every psychosocial hazard has improved in terms of its impact in the experimental sites. Where we did nothing in those control sites, it actually went down. So not doing anything, not only does it mean that you're likely to stay at least at status quo, reality is it's probably going to get worse because these hazards don't fix themselves. So if you don't do anything, the likelihood is you're going to have more negative impact. You're going to have things like increased turnover, increased sickness leave, increased claims. So this really demonstrates that, you know, doing something and targeting where you want to target those interventions to get the best ROI is really, really critical to the success. And seeing that pretty much every single hazard was starting to be viewed differently was a really, really positive result for us, really positive outcome. I'm conscious of time and I want to leave a little bit of time potentially for Q&A and also to hand back to Lara. But just before we do that, we also looked not only just at the WIPSI results, but we looked at the employee engagement results and various other data points as well from our client organisation. And what we saw were that there was more reporting of safety incidents, and that was physical safety incidents, which was what they want to report more, but actually have the consequence of those incidents be less. So there was a reduction in the frequency of the higher severity incidents, which is great. And that's part of people feeling safe to speak up, people feeling that they can have conversations with their leaders. So more reporting, but less severe consequences. We also saw a change in the advocacy rate for the client organisation, that people actually wanted to be there. That had improved significantly as well. Turnover started to go down, and we also saw an increase in the wellbeing scores as measured by their internal processes as well. So we can see that you start somewhere and it will absolutely have an impact and a ripple effect across so many of the different outcomes that we're looking for in terms of psychological health and safety and being best practice in that. So the key takeaways in terms of that project and more broadly in terms of psychological health and safety is, you know, follow those steps, follow the 4 steps, and consult, and prioritize what you want to tackle, what you're going to tackle first. You're not going to be able to tackle everything. Choose the things that are either impacting most at the moment, or where you have most influence over as well. Take that holistic integrated approach as well. So look at your prevention, your protection, support mechanisms, make sure you've got a spread. Look at those 7 workplace strategy areas, make sure that you've got a spread of interventions across those different strategy areas. You've got that great ecosystem of support, and make sure that there is on the ground support for implementing any changes that you want to make, implementing any controls that you want to execute on. So that on the ground support is absolutely critical for success as well. And you can see there's a final poll up there. Thank you, Josh. Just asking you what your priority after this session is going to be. So whether that's identifying the risks and the extent they're impacting, reviewing what you've already got in place, or engaging with senior leadership, or exploring the tools and the support that you might need to put in place some action. So it's a reasonably even spread across those at the moment, just with exploring tools to support action coming out as the most likely next step for people. So I will wrap up there, and I will hand back to Josh and then to Lara.
Thanks, Krisha. Great case study there. And I mean, really love how for that project there was a control group as well. So you can see that doing nothing isn't going to change, and you can just see the big difference in a integrated approach for a large organization. Just last thing from me is Lara will be obviously sending out some comms post the session. We can only do so much in 1 hour. So we will be running a ticketed event over 2 half days, last week of July, first week of August, on creating a psychological health and safety action plan. In that session, you'll actually work through your current situation and start to develop that action plan over those 2 half days. There'll be a bit of homework included for that as well, so that you can really springboard your psychosocial risk action plan there. We'll also be offering just some 30-minute consults as well to get a line in the sand about where you're currently at and where your first priority areas might be as well. There'll just be a few of those positions available, so look out for that in the follow-up email. Thank you, Lara. Oh, and from a Q&A point of view, everyone was very quiet today. So don't worry, you'll get all of the info and you can come back to us with any questions as well.
Thank you, Krisha, Josh, and AP Psychology and Consulting for sharing your knowledge and valuable insights this afternoon, and most importantly for supporting DXC. No doubt there might be some burning questions later on once everyone digests some of this information. The DXC team will send out a post-webinar email, so please keep a lookout for that information. It will include the recording link, information about AP Psychology and Consulting, and of course that slide pack. And any questions, please do reach out to one of the DXC representatives. And again, I'd like to thank everybody for attending this afternoon, and for AP Psychology and Consulting, and Krisha and Josh. Have a wonderful afternoon.
Thanks so much, Lara. Enjoy the rest of the day, everyone. Bye for now.
Bye.
Goodbye.